My name is Jorge Plutzky. I'm the Director of Preventive Cardiology at the Brigham and Women's Hospital and have a longstanding interest in the intersection between diabetes, metabolism, and cardiovascular disease.
My name is Jane Reusch. I'm a professor of medicine and associate director of our Center for Women's Health Research. We want to start with what's in it for them. And then we want to say, so there are a couple of things you want to know about because there's a bit of a runway to get used to taking these medicines. For example, many people will feel nausea. Now, this nausea that you feel when you first take these agents, that is not why people lose weight. You might in the first weeks lose weight because you're not feeling like eating because of nausea. But in general, you want to help them understand that this nausea that they feel, and even if they have vomiting, there are some hygienic strategies they can take. They can have a smaller meal. They cannot eat close to bedtime. They can avoid fatty meals. And then these symptoms over the first 6-8 weeks, but really in the first 2 or 3 weeks, will start to really become less and less for the majority of people. And then when you're thinking about titration, you really start at that low dose. You start at a low dose. It may or may not really have glycemic efficacy at a low dose, but in many people it does because they're not eating very much. You don't titrate until they are not feeling bad every time they take their shot. We usually wait a month before we titrate the dose, but we can wait 2 months. And then when they go to the next dose, they might feel no untoward effect.
Right. So you tailor it to the feedback you're getting from the patient. And I think very often this can be done if you are in a cardiology practice in collaboration with a primary care physician or through one of your advanced practice providers. It doesn't have to be the doctor.
Yes, or even pharmacists. Pharmacists are becoming very adept at this, just like we use them very closely when we're trying to get patients on statins and we check their LDL and see if we've got the right dose. We can do a similar thing. And I feel like that tends to be most effective because then they don't end up getting a fill for a medicine that they can't tolerate. They get the right dose filled.